In a clinical session, all attention focuses on a single point of contact, the practitioner working to restore patients' mobility. It is easy to assume the biological recovery happening in this room is driven solely by the physical skill applied to the treatment table. Yet healing often hinges on factors that exist outside the clinic, during the hundreds of hours between appointments where clinical influence traditionally vanishes. Even the most precise manual therapy fails when a patient loses their routine. Clinical skill cannot compensate for the physical consequences of broken momentum. That momentum often breaks at the front desk. Many clinics still rely on manual infrastructure, paper calendars, phone tag, and handwritten lists. This forces a person in pain to navigate scheduling and coordination during narrow business hours, often while they are managing their own professional responsibilities. This chart maps the patient journey through a manual booking system. We see clear dropout zones where the intent to schedule is met with full voicemails, after-hours dead ends, and missed reminder calls. Administrative friction degrades biological healing by eroding the consistency required for tissue recovery and physical habit building. Modernizing practice management involves replacing these manual bottlenecks with automated digital workflows. AI chatbots and WhatsApp business automation now handle the constant influx of scheduling requests and routine patient questions. This data visualization shows the impact of these tools. Automated routing resolves 80% of incoming queries, leaving only the remaining 20% for human intervention. Patients get immediate answers at any hour, while the practitioner is shielded from the administrative noise that normally interrupts their day. Offloading these routine inquiries is a necessary step to ensuring that clinical work remains the practitioner's primary focus. Effective physical therapy requires biological progress to be tied directly to strict scheduling adherence. Using this logic chain, we can see how replacing restricted phone hours with 24/7 digital access leads to a locked appointment. When booking is frictionless, patients demonstrate a higher level of commitment to the care plan from the very beginning. Automated reminders then step in to eliminate the missed sessions that stall progress, securing the path toward physical recovery. By removing the hurdles to consistency, SoftMA creates the environment necessary for the body to heal efficiently. In an optimized clinic, the complex digital infrastructure managing the business remains entirely invisible to the patient. Healthcare professionals sometimes worry that digitizing these interactions will make patient care feel robotic or distant. However, practitioners forced to perform manual data entry and juggle phone calls are the ones who end up acting like machines. True personalization requires removing the professional from the repetitive, mechanical tasks of running the business. As invisible infrastructure manages the schedule in the background, the daily reality for the wellness professional changes. The clinical environment becomes characterized by uninterrupted energy and intense focus during every patient session. Digital systems preserve the practitioner's energy by handling the repetitive administrative tasks that would otherwise drain their attention. Automating clinic operations secures the environment where practitioners can provide their most valuable asset, undivided human attention.